health insurance plan may be changing next year because of the growing cost burden of wildly popular drugs like Ozempic. As WBZ's Brandon Truitt shows us, one company is pulling back coverage while Massachusetts taxpayers will cover the cost for other patients.
These weight loss drugs have been skyrocketing in popularity and in price. And as you're about to see, they are crippling budgets in the public and private sector.
The insurers need to draw a line in the sand and play hardball with these big pharma companies.
Massive changes for one of the fastest growing classes of medications. On Thursday, Blue Cross Blue Shield of Massachusetts announcing that starting next year, standard plans will only cover GLP-1 weight loss drugs for diabetes and not weight loss. Studies suggest nearly 1 in 8 adults have taken drugs like Ozempic and Wegovy. Usage has taken off and so has the price. Blue Cross Blue Shield says 5 GLP-1 drugs accounted for 20% of their pharmacy spend, totaling more than $300 million last year. That's double the year prior. The company says the surge in spending is putting a heavy and unsustainable burden on our employer customers and members who are struggling to keep up with rising costs.
Right now, if you have a mandated coverage on insurance at very high reimbursement rates and high usage, it's going straight to their bottom line.
In a meeting on Beacon Hill Thursday, the state's Group Insurance Commission reported these drugs are blowing out their budgets too.
The GIC has been averaging a fairly significant monthly deficit of about $20 million.
That's the average monthly deficit due to rising provider prices and increased demand. The GIC is now asking for an additional $250 million from the legislature to balance the budget, while small businesses say they'll now avoid a double-digit premium increase.
Pharma companies have to decide which is more important to them. Very high premiums or very high costs, reimbursements for these drugs, or high volume. They can't have both.
If your workplace does not opt into that extended coverage, those who use these drugs for weight loss would have to start paying full price by January 1st. But people who use the drugs for diabetes treatment would continue to get coverage. In Boston, Brandon Truitt, WBZ News.